Felvin is an NSAID. My name is Dr. Oluwaseun Ojo, and this is Ask the Expert. NSAIDs are non-steroidal anti-inflammatory drugs. They are used to reduce inflammatory responses, inflammatory reactions. Inflammations are injuries, unpleasant response to injury. NSAIDs also help to reduce pain, because when these injuries happen to our body, it stimulates our nerves endings, so we become more sensitive, and also it helps to reduce fever. That is what NSAIDs primarily do. Prostaglandins are chemical messengers that are released via two pathways, either the COX-1 or the COX-2 pathway. For the COX-1 pathway, the prostaglandins are protective. They are found in the lining of our stomach and also in the kidneys, so they protect our stomach and our kidneys. However, in the womb, they also line the womb. You can see them, they are being secreted around the lining of the womb. So when they do that, they are implicated in menstrual pain that a lot of women experience. However, most of the women, about 20 to 30% of the women have the normal level of prostaglandin being secreted, but 50 to 70% of women secrete excessive prostaglandins in higher quantity. So when prostaglandins is being secreted in high quantity, what does it do? It causes hypercontraction of the womb, and therefore it releases a lot of blood following it. There is excessive shedding of the uterine wall. That is what happens. The uterine wall begins to shed excessively, and you begin to experience heavy bleeding. So what NSAIDs, just like Felvin, for example, what it does is that it inhibits this action. Therefore, there is reduced contraction. There is no hyper rigorous contraction of the uterus that is causing you that pain you are experiencing. So it reduces the contraction. Therefore, you don't bleed so much as it should. You don't have any blood stored somewhere just because you are taking NSAIDs like Felvin. No, it just reduces the hypercontraction that you experience that is causing you so much pain. That is what it does. It reduces it. It reduces the pain sensation, and also it also makes the nerve endings responsible for pain. It makes them less sensitive, so you don't get to feel the pain so much as you should. So there's no blood stored somewhere in the body that is not coming out. So if you see that your blood flow reduces a bit, it's not as if there's a blood that you're supposed to bring out that you're not bringing out. You don't have any bad blood inside of you stored somewhere. No, you don't have that, and it's reducing your pain. So it's a win-win. Felvin is an NSAID, like I've mentioned. It can be used to manage various kind of pain, from your head to your toe. Various kind of pain. Therefore, Tunde, Lade, Odinaka, you can use Felvin. Daddy Tade, Mommy Godwin, you can use it. Any kind of pain, you can use Felvin. Just adhere to the precaution and use it just the way it should. So headache, Felvin. Toothache, Felvin. Backache, Felvin. Knee pain, Felvin. Arthritis, Felvin. Menstrual pain, Felvin. Thank you. Just like every other medication, you have to take it with a glass of clean water. Make sure that you are taking it with food, not on empty stomach. Make sure that you are not taking 2 NSAIDs at the same time. No, don't do that. And also, make sure that if you are not getting any better within 2 to 3 days, you visit your doctor. Does NSAID changes the color of your menses? Obviously, it doesn't. Because when you're experiencing menstrual pain, there's the primary and there's the secondary cause of menstrual pain. So you may be experiencing the secondary dysmenorrhea, that is secondary pain, that is due to something else, and not even just pain alone. That is why you have to see your gynecologist. If you notice that your blood flow, the color of your menses is not the normal color, the bright red color, and it has been ongoing for a while, please see your gynecologist. Also, if you notice that you're also using it for any other kind of pain, maybe your arthritis, or you're having persistent headache, or any form of pain, back pain, please see your doctor. It is very, very important. Mama Nkechi, you feel born 2, you feel born 3, you feel born 4. Felvin does not stop you from giving birth. Please go on, take your Felvin. Are there side effects of NSAIDs? Yes, every drug has its own side effect. Even the food you eat, obviously, has side effects when you take it so much. So NSAIDs also have its own side effect. If you know that you've been diagnosed of peptic ulcer disease, please get prescription from your doctor before taking it. If you know you're asthmatic, please see your doctor before you take NSAIDs of any form. Also, if you know that you are on some certain antihypertensive, which we call ACE inhibitor, please, you are taking antihypertensive before you take any NSAIDs, please see your doctor. If you've been diagnosed of any kidney problem, please, I beg, see your doctor. It is very important for you to do that. NSAIDs are safe to use, provided you don't have any of the conditions that I've mentioned. It does not affect you from giving birth. Please follow, like, subscribe, and stay tuned.